Authorities and health workers are ramping up effort in response to the Ebola outbreak in the North Kivu region in the Democratic Republic of Congo. Observers say health workers in Beni, Eastern DRC, face logistical challenges as they try to control the Ebola outbreak. Beni is an important trading hub that has been identified as the new Ebola flashpoint. The outbreak has so far killed 91 people among 132 cases in Congo's North Kivu and Ituri provinces. Some areas near the epicenters require armed escorts to reach because of insecurity challenges. Now, joining me live via Skype from the city of Beni in the DRC is Yves Villemot, UNICEF Communication Chief in the Democratic Republic of Congo. Yves, welcome to the show.
Good evening.
So you are presently in Beni, which has been cited as a new flashpoint. Can you give us a sense of the situation on the ground?
Well, actually, I'm in Butembo, and okay. Butembo is the new center of Ebola. We have been facing Ebola in this region since early August in Mangina and in Beni. And now, unfortunately, we have been faced with new cases south of Beni in the city Butembo, where I'm right now. And we are particularly worried about the evolution of the epidemic. It's extremely important that we are capable of controlling the epidemic here in Butembo, because this is an important commercial city of more than 1 million inhabitants with a lot of trade and traffic. So it's extremely important that we try to control the disease as quickly as possible before it spreads in Butembo.
So there have been reports that given the insecurity in the region, this has created a serious problem in terms of intervention. Can you tell us more about that? To what extent is insecurity affecting your work on the ground?
Well, insecurity is a big issue in the province of North Kivu and the province of Ituri. But luckily, the areas that have been affected by the disease, by the epidemic in Mangina, in Beni, and now in Butembo, these are areas that we can still access easily without significant security problems. We have to be cautious. We have to be particularly attentive, keep radio control, etc. But all these places, for instance, remain accessible without military escort, which is not the case for the places north of Beni as well as south of Butembo. If the disease would further spread to these areas, for sure the insecurity would be a main challenge for our operations as UNICEF, the government, and our partners.
So what are the strategies that are being really focused on right now to ensure that the disease doesn't spread further, and whatever is happening now is being contained?
Well, we as UNICEF, we are particularly active in the area of communication, sensitization. We are active in ensuring access to water, sanitation, and hygiene. And we are also working in terms of guaranteeing psychosocial assistance to families that are affected. And the issue of communication is a particular important issue, because obviously the disease is a deadly disease, an extremely dangerous disease. But at the same time, if people have the correct behavior in terms of respecting basic rules in hygiene and systematic and regular hand washing, we can ensure that the spread of the disease is limited and that the disease and the epidemic is contained. So what we are doing here as UNICEF, as we are deploying our activities in Butembo, is to make sure that the local population is being informed about the disease and how to protect itself against the disease. And we are scaling up our program so that everybody in the city knows how to protect himself against the disease, so that we can control the disease here in Butembo.
And quickly, before we wrap, tell us about the role that the community is playing in your strategy.
Well, the community is crucial. I would say that the community is the most important actor in controlling the disease. It's the community that will make sure that people actually, at the end of the day, have the correct behavior. We can support them, we can guide them, we can give them the necessary information, but at the end of the day, it's the community that will be capable of making the difference in terms of having the right behavior.
Okay, Yves, thank you so much for joining us.
Thank you very much. Have a good evening.
You too. And that was Yves Villemot. He is a UNICEF Communication Chief in the Democratic Republic of the Congo.